Good afternoon, everyone. My name is Andrew Pariser, and as you know, I'm the VP for ResCon. I'm also the chair of the Health and Safety Committee, and I just want to start by recognizing the role of ResCon's Health and Safety Committee, as well as ORCA, as well as Amina and Ahid. These events are quite a bit of work, and we have an excellent team here that works together to, one, address, but also make sure that the issues that we're talking about are the issues that our members and the broader residential construction sector is facing. It's also very important to recognize the Ontario government, who's made incredible investments, especially in the last 12 to 18 months. And I'd also like to recognize our other safety partners, which includes the Chief Prevention Office, as well as the Infrastructure Health and Safety Association, which I lovingly refer to as IHSA. This is a very important issue for ResCon, and we are committed to meaningful change. This is our third event. So our first event was obviously 3 years ago now. And in that event, we looked at addressing the stigma and raising awareness. In the second event, we started to look at data and the services available to the construction sector. And in the third event today, we're going to continue that focus, but we're going to dive a little bit deeper and specifically focus on what employers need to know and do to improve and expand their mental health initiatives. I think all of our speakers are going to be excellent today, but I would like to note that we're going to have a gentleman named Rob join us, and he's actually going to take us through his story and how he overcame his addiction. And so while investments and resources are at an all-time high, so is the need. COVID-19 is a true pandemic, and it has impacted both our physical and our mental health. We also know that in order to understand mental health, we need to understand the mental health spectrum. People are not either mentally healthy or mentally sick, but somewhere in between on the spectrum. And that position is always changing, and it's impacted by things like work, home, family, physical wellness, and about 100 other factors. We also know that an ounce of prevention is worth a pound of cure. We heard this last year from the Chief Prevention Office, and I think we're probably going to hear something similar today from Dr. Joel Moody. As you listen to today's speakers, I urge you to take some time to reflect on three key issues. One, how has construction grown to deal with mental health issues, but what does construction need to do to continue to grow? Second, how is your own mental health? Do you need to ask for help right now? And do you know where to find the help you need if you do need it, or if you need help in the future? The third one is, how is the mental health of your coworkers, your employees, your families, your colleagues? What are some meaningful things that you can do in your day-to-day to improve or focus on the mental health of others? Our speakers are going to address all three of these questions, and they're going to set the tone for ResCon's mental health efforts, as well as ORCA's efforts over the next year. But people came to hear the speakers, not to hear me. And so I'm going to kick it over to Amina, who's going to introduce our first speaker.
Thanks, Andrew. Prior to taking office, Minister Tanzola volunteered as a certified addictions counselor and advocated for a bed-based therapeutic community in the city of Vaughan, seeking to support those struggling with mental health and addictions challenges. Passionate about helping those faced with mental health and addictions challenges, Minister Tanzola is currently pursuing his PhD in clinical psychology with a focus on addictions and concurrent disorders to the University of Southern California. Minister Tanzola proudly serves the people of Ontario as the province's very first Associate Minister of Mental Health and Addictions, and is looking forward to creating a connected system of care with comprehensive wraparound services so that every Ontarian can be fully supported in their journey towards mental wellness.
Hello, everyone. For those of you who may not know me, my name is Michael Tobolo, your MPP for Vaughan Woodbridge. I also proudly serve the people of Ontario as the province's very first minister responsible for mental health and addictions. I'd like to extend a heartfelt thank you to ResCon's leadership, including your president, Richard Lyle, for extending the invitation to speak to all of you today for the third annual ResCon Addressing Mental Health and Addictions in Construction Symposium. In a year unlike any other, people of all ages have been forced to adapt to the challenges brought on by the COVID-19 pandemic. As COVID-19 has spread through our communities across the country and around the world, it truly has tested our collective resilience. Without a doubt, this global pandemic has had an impact on the lives of millions, including significant impacts on the mental health of so many in our construction sector. With many financial challenges and uncertainty about the future, we know this pandemic has resulted in so many new and more complex challenges than we have ever seen before. For example, we know that many Ontarians, including those in the construction sector, have been experiencing increased anxiety, depression, and suicide ideation, as well as more substance use. And in fact, we know that 30% of those tragically passing away from opioid use last year worked in the construction sector. We have seen new research and data that indicates the mental health of so many in this important sector has been negatively impacted by this terrible pandemic. I know that all of us have been extremely concerned about these impacts, and I'm very glad our government acted quickly to respond to them. First, we invested an additional $194 million in emergency funding to immediately expand access to mental health and addiction services during the pandemic. We did this because we know that no one patient is the same. The small business owner struggling to get by in the face of a global pandemic, the long-haul truck driver feeling isolated from friends and family, and the construction worker doing his or her duties in the middle of a public health crisis or simply being forced out of work due to travel restrictions. Each of these individuals has unique needs, but by matching them with the most appropriate supports, we know that we can make a real difference in their lives. And that's why I'm so proud to see that our investments included support for community-based mental health and addiction services, interprofessional primary care teams, mental health supports for healthcare workers, and expanded virtual mental health and addiction supports for Ontarians of all ages. These virtual supports are being accessed by over 110,000 Ontarians from all walks of life today. I encourage all of you to access these services by visiting ontario.ca/mental health. They are confidential, effective, and available to you free of charge. Once we recover from this pandemic, and I assure you that we will get there, we can expect that the mental health and addictions impacts are likely to extend beyond a return to normal. And I'm committed to working with ResCon and its leadership to address the challenges that may lie ahead of us. For such a long time, our society has stigmatized those struggling with addictions or mental health challenges, especially in the construction industry. Now, with the COVID-19 pandemic, I'm very encouraged to see a growing awareness and improved support for those experiencing and living with mental health and addictions challenges. More and more, we are addressing the stigma attached to mental health issues. We are seeing people coming forward to talk about their own struggles or to raise their voices in support of friends, families, and neighbors who may be dealing with a mental illness. Thankfully, we have come a long way, but we still have quite a long way to go. I am especially proud of the most recent investment we made, which is an additional $175 million in funding for mental health and addictions care announced through this year's budget. As part of this funding, I was proud to announce $32.7 million in new annualized funding for targeted addiction services and supports, including treatment for opioid addictions. This funding will help to enhance access to evidence-based, high-quality addiction services and address urgent gaps in needed supports across the continuum of care. These investments include $6.9 million in provincial opioid response investments, such as adding harm reduction workers province-wide, expanding RAM clinics, and establishing acute consultation services in areas with high rates of opioid use. We're also investing over $18.8 million in bed-based investments for those who need more intensive supports. This means more adult addiction treatment beds, which I strongly advocate for. We have also invested $2.5 million in Breaking Free Online, an innovative therapy tool that makes it faster and easier for Ontarians to access safe and effective addiction supports for over 70 types of substances, including opioid addiction. I encourage those of you who may be struggling to register at breakingfreeonline.ca for free access to programming and resources for 2 years. Our investments this year also include funding for 4 new mobile mental health and addictions clinics to help serve remote, rural, northern, and underserviced regions of the province. This is an extremely innovative program that will ensure people are able to access the care they need when and where they need it. Because whether you live in a large urban area or in a remote or rural area, you deserve access to the highest quality mental health and addictions care available. These investments are part of Roadmap to Wellness, our action-oriented plan to build a connected and comprehensive mental health and addiction system, which our government put forward last year. I'm sure many of you will agree when I say that mental health and addictions is clearly one of the more pressing healthcare issues of our time. Half of the population here in Ontario will have or have experienced a mental health challenge by the age of 40. And we know that over 1 million Ontarians experience a mental health or addiction challenge each year, which has only increased during the pandemic. We see, however, important progress in how we approach and treat mental health and addictions, and we are delivering real and meaningful change. Again, I want to thank all of you for taking the time to listen, and thanks again to ResCon for extending this invitation and for the incredible work that you're doing. Mental health is health, and you know, it's okay to not be okay. When it comes to mental health and health, you can't have one without the other. Simply put, they are both important. They both need to be looked after. Thank you so much for your time today. Stay safe, and God bless all of you.
So now that everyone is here, and we'd like to thank Minister Tanzola for delivering remarks. He's participated in all 3 of our mental health symposiums, and he's a great partner to ResCon and the residential construction industry. So now that we're all here, I believe, all the speakers, we'd like to do a quick photo. So Dr. Bender, I don't know if you can turn on your camera, and then we can smile for 10 seconds while Ahid takes a photo. Perfect. So our next speaker is Dr. Joel Moody, the Chief Prevention Officer for the Ministry of Labor, Training and Skills Development. Dr. Moody joins the ministry from the Electrical Safety Authority, where he held the role of Chief Public Safety Officer and Senior Director of Analytics. He is a seasoned public health and occupational health and safety leader with over 17 years experience working in various labor organizations throughout the province of Ontario. As a member of the ESA's senior leadership team, Joel led its future strategic direction to achieve its Getting to Zero vision of safety in Ontario. He held numerous high-profile projects, which included developing strategies and tactics to combat electrical fires in high-rise occupancy residential structures in Toronto. He has championed innovative approaches to harm reduction and regulatory oversight, and made equity, diversity, and inclusion central to his philosophy of leadership. Joel has an advanced certificate of epidemiology and biostats from George Washington University, where I also did my master's. Is a Master of Public Health and International Health from the University of Alabama at Birmingham, and is a Bachelor of Science and Engineering from Duke University. So 2 really good sports schools there. So welcome, Dr. Moody.
Well, thank you so much, Amina and Andrew, for letting me come and speak with you today and speaking to everyone. Like I said, introductions are great. It's just work that you've done in the past, but there's so much more work that we have to do together, and I'm looking forward to accomplishing those with you all. I've had the opportunity to be on a few of our ResCon events recently, And, I'm super excited about the work that ResCon does. And I'm very proud to be a part of another amazing example of really how ResCon and the construction industry are working to be leaders in health and safety. So thank you very much. As I started my role here as a CPO, one of the first briefings that I had was about the topic of mental health in the workplace, addictions, and violence and harassment. It's a topic that's near and dear to me. I have sat on the board of directors for the Canadian Mental Health Association Toronto branch for about 6 years in the past, and really worked to help the clients from the standpoint of, the three things that we talk about with mental health, and that's, having a residence or house or home, having a friend, and also having a job. So when we talk about those aspects around mental health, it is so important that we have symposiums like this. And I know it's not a surprise for you that mental health is becoming a topic that's more prevalent in society, not just from a workplace standpoint, but as the minister said, at some point each of us will experience either ourselves having some mental health challenges, or we will know someone that will have mental health challenges. And so as we talk about wellness, both the physical health, the mental health, the health of the individual, those are the questions that we'll have to discuss moving forward, especially now. We're in this time of COVID, a time that no one really, projected, 1 in 100 years with, pandemics moving throughout the world. But I think it's a very important time, because when we're talking about mental health, we are seeing some of the signs of isolation. We're seeing some of the signs that happen when we are not truly aware of that uncertainties that happen within our society, because that change in what we once thought is normal is not there. That change in what we thought is once our routine is not there anymore. So how do we look at this very broad public health concern at the societal level? Because it does create increased risk, and especially when we talk about injury or unfortunately fatalities on the workplace, mental health is a risk factor. So why is that important? Because, well, as you know, we've released our new provincial strategy called Prevention Works. And in that new occupational health and safety strategy, we've identified workplace mental health, workplace violence, and harassment as one of the areas of system focus. And that definitely includes the construction sector. So having better evidence and improving our knowledge and practices in this area, we can better support our staff, our employees. We can better support our businesses of all sizes, because ultimately by improving that mental health, it improves the culture that exists from a safety standpoint. But just improving is not enough. We need to evaluate. We need to ask ourselves questions. What is working? What is not working as well? Such that at the end of the day, we are providing the best impact to those that need the service. So as our partners, health and safety associations, our stakeholders, over the next 5 years, we will be prioritizing and using communication and coordinating activities across the occupational health and safety system. As I said before, mental health is something that is also of keen interest to our Prevention Council. So our chair, Erin Oliver, our co-chair, Patrick Bourgeois, they are champions in this regard. And I commend them, and the whole council for also prioritizing this very important issue. So as a council, they are engaging with their networks and their leaders and their sectors to better connect how the government's mental health strategy can also connect with our workplaces. We've talked about COVID. We've talked about building our health and safety plans, but I noticed that sometimes the concept of mental health is sometimes overlooked as we are developing those safety plans. We know many different aspects around the physical hazards, hierarchy of controls, very near and dear. So I would encourage all of our employers and employees here today to continue creating that awareness around mental health so that you can build it into your safety strategies moving forward. Because it is a key tool that helps you identify issues and be ready to address those concerns before they happen, not when they happen. So think about those new risks. As we said, the questions around isolation, the questions around change of your normal routine, working remotely, working in an environment with new restrictions. What does that mean for one's mental health? So I'm super excited because today's symposium has some great speakers lined up. So definitely was an honor to hear words from our Associate Minister of Mental Health and Addictions, Minister Tobolo. And as I said, it is a priority of ours to ensure that we're working with the ministry to continue to bring attention to find solutions. So thank you once again for having me, and look forward to the symposium.
And thank you for those remarks, Dr. Moody. Just going to join you. Oh, I was going to join you on the spotlight there. But as we learned with COVID, health and safety really starts to work well when you get government, employers, and labor together. And I just can't compliment you enough. We haven't missed a beat. And I think Ron really did a great job, but for you to jump in and kind of carry the torch and take over the way you have, that's incredible, because it was our expectations as an industry were high, and you're certainly meeting them. And it's nice to be able to work with government, but specifically with you in your office. One, you get us, and two, we've got common goals, and you're there to help us achieve them. And I think that partnership, and then, when we're able to bring in labor, and we do have a number of representatives from labor on the webinar today, it all starts to come together. So really thank you for your efforts. They're noted and they're appreciated, but also thank you for the efforts of your staff, because obviously they're doing a great job as well. So thank you. And we're going to keep bringing you back. So we like to try and see about once a month, and I think we're on pace for that. So thank you again for that. So moving on, I'm going to spotlight somebody new. And this person is someone you've seen before. And so I'll read her bio, even though you guys probably don't need an introduction. And so our next speaker is Carissa Tanzola, and she is a partner with Filion Wakely. We'd like to acknowledge and really congratulate her. She was named in the 2022 edition of the Best Lawyers of Canada, with a specific focus on workers' compensation law. She is an experienced litigator, investigator, and former vice chair of WSIAT, which is the Workplace Safety and Insurance Appeals Tribunal. And she provides proactive, practical, and cost-effective legal advice while always being mindful of business objectives. She's also been named to the Refer to Her list, which is a prestigious listing of experienced female litigators to whom work can confidentially be referred to. And so without further ado, we're going to let Carissa share her screen and thank her for joining us. And she's essentially going to give us a legal update now.
Thank you, Andrew. And good afternoon, everyone. I'm just going to take a second to share my screen and get that set up because I struggle with speaking and doing technological things from time to time. All right. That should do it. Andrew, can I get a thumbs up that you can see the presentation? Great. All right. So again, good afternoon, everyone. And a special thank you to the folks at ResCon for inviting me to speak on this important topic today. Andrew's introduction was very generous. And I think to simplify it, I spend a lot of time working with workplace parties, specifically employers, on things like, what do I do when an employee is absent? What do I do when an employee is injured? And more and more and more, those injuries have to do with mental health, and within that, addictions as well. So that's what we're going to be focusing on today. And we're also going to spend a little bit of time with a lens on legal implications or legal reasons why this is, in fact, your business. Now I have to advance the screen. Let's give this a try. Oh, geez. Oh, I don't even know what I did, but that works. Okay, so it is your business. And I actually struggled, and Andrew and I spoke about this a little bit offline. Do I call this whole presentation, It's Your Business? Let me tell you why. We hear time and time again from businesses, this kind of, I'll call it excuse. It's not my business. This is someone's personal, private information. Get it together, leave it at home. Don't bring it to the workplace. If you're talking about substance use or abuse, control yourself. Those impulses don't belong in the workplace. And I have to say that these sentiments are just not acceptable nowadays, both from business considerations and from legal considerations. And in fact, not only are they not accepted, they will absolutely create legal liabilities. So it is your business, both literally and figuratively. And I'll leave that little saying there for now. So getting more into the legal side of things for a moment. So to draw on legislation, the Human Rights Code indicates, right, that every person must have equal treatment or is entitled to equal treatment for a whole slew of reasons, which we reference as the protected grounds. You've heard these before. Your race, ancestry, place of origin, color, I can go on, but I want to focus on disability, right? So the Human Rights Code specifically says that individuals must be treated equally when it comes to disabilities. Well, what does a disability mean? I think there's no argument that if somebody has a bad back, an issue with their physical self, that may be considered a disability. Well, what about a mental disability? It's taken us a while to get there, but I can say that mental disabilities are included within what we consider those protected grounds. And I have provided a definition according to the DSM-5, which some of you may be familiar with. And it just kind of characterizes or signifies that mental health issues, aren't necessarily something that we can provide an easy list for. They're wide-reaching and they can vary depending on the person, depending on situations that they have no control of, maybe even situations that they do have control over. But that's not relevant to when we get into legal considerations. I will pause and say that there are exceptions. There's always exceptions. For example, just because a person is feeling maybe not as happy as normal or stressed for whatever reason, doesn't necessarily mean, legally speaking, they're suffering from a mental health issue from a legal perspective. That said, I caution any employer from jumping to that conclusion. There's a very specific procedural analysis that you have to go through legally before you say, I don't need to pay attention to this, which we don't have time to get into today. But I did want to flag, just for completion's sake, that it's not always just because somebody says they have a mental health condition, but we do need to take it seriously. What about addictions? So as I indicated, we've kind of come to accept that mental health conditions are considered disabilities. I think society is catching up, but we were even slower to recognize that addictions can be classified as a mental health disability or require accommodation on their own. This is a case from only 11 years ago that confirms, in fact, somebody with an addiction that can be considered a disability. And in fact, interestingly, just for the history buffs here, only 10 years ago, we were still referencing legislation that used the term handicap. So we have come far in a fairly short period of time, all things considered. But this slide is to say that addictions, there's no dispute. If somebody has a clinically diagnosed addiction, that is a disability that requires accommodation and consideration from an employer's perspective. I know that there's a lot of labor folks on the session today, people from unions, etc. It is a multi-party system, right? So if there is an individual that requires accommodation, while the employer typically can initiate the process, both the worker, the employee, and any kind of labor group also needs to participate in that process too. So going back to what I said, right? It's not my business, but is it your business? This is why it absolutely is your business. There is something called the duty to inquire. And the duty to inquire becomes especially relevant when we're dealing with mental health conditions and issues that present themselves potentially in the workplace. It's this concept that if you ought to have known that somebody required accommodation or that somebody was struggling, as part of the accommodation process, a workplace party, such as an employer, needs to inquire, right? They need to ask. I want to spend just a moment unpacking that for a second. A lot of you might be scratching your heads and saying, but I'm not a clinically trained psychologist or psychiatrist. Again, what business is it of mine? Case law has been very clear that you don't need to be a trained medical professional to realize that something might be unusual or wrong. Some examples are, if you know that individual because they've been in your workplace or your work site for some time, you have almost a baseline of who they are. And if suddenly they're acting out of sorts, out of character, if there's a marked departure, then that would beg a question. Are you okay? Do you need anything? Can I assist you with anything? And you can insert your own commentary to how you would go about approaching that. But that opens up a conversation to let that individual know that you're there, that you have time and ears for what they might have to share with you. And it also assists in your legal obligation to see if accommodation is required. Now, what do I mean by accommodation? Again, we could be here for a day talking about this concept, but it's the idea that that person may need something changed in the workplace that you can readily provide to them that's not going to cause any kind of hardship to the employer. It may mean that, I'll go back to that slide in a second. It may mean that they need to take a leave of absence. Maybe something needs to be modified. Maybe they need to be transferred. I know that can be difficult with collective agreements, and I know that can be difficult with various trades on construction sites, but the procedural obligation is that you consider it, right? That's your duty to accommodate. A couple of notes on the slides that I've just passed. This duty to accommodate cannot be outsourced. There are many, many companies, insurance companies included, that will provide these services for employers. And I'm not suggesting that that's not proper. I'm not suggesting that they don't do a great job at it. But there have been difficult cases where there has been a delay, let's just say, or the employer assumes that the third party is taking care of these things and something's been missed, or there's been a difficult delay that has caused the worker lack of pay or a hardship in another sense. And the Human Rights Tribunal and arbitrators have said, you can't point your finger at that third party that you've outsourced these duties to. It's still your duty. So just a little flag there. Those services are great, but you still need to be mindful of the status of the various cases. And the other slide that I passed, and I won't go back to it, my apologies, I just don't trust my technological skills, is the 3 questions that you do ask if you are looking at accommodation. And I'll just give them to you. You guys can write them down, or maybe you already know them. But the first is there a mental health condition that is recognized as a disability? And for that, you likely need something from a doctor saying, yes, in fact, there is. You are entitled to that information and you can ask for it. If there is support for a mental health condition, then you need to understand how that may impact the employee's ability to work. We've seen many cases where somebody who's suffering from an acute mental health condition, it's just simply not safe for them to be around machinery, or if there's an addiction issue, they need time off work to deal with that. And those are the questions that you sort through as you're dealing with that second criteria. And then finally, once you understand that criteria, can you facilitate that accommodation? That's known as the procedural analysis. And that's what we do in each and every case where somebody might require accommodation. I want to mention the duty to investigate. And I understand that I'm going through this pretty quickly, but the reason why I bring up the duty to investigate is it's yet one more thing that the employer has to be mindful of. When we're dealing with mental health conditions in the workplace, we see from a legal perspective that they may present in a way that's caused a workplace violence or harassment issue, or maybe in part the result of a workplace violence or harassment issue. And so it's not unusual for somebody's mental health or addiction to come to light because they're alleging that somebody is bullying them, or one of their coworkers is alleging that, you know, maybe somebody had a moment in the workplace that was unprofessional, and it comes out that there's a mental health condition underlying all of that. So it can be sometimes overlapping and confusing to sort through from an employer's perspective. But never forget that as you might be dealing with accommodation issues that we've just gone through, you also need to investigate any complaints of harassment or violence or discrimination if it's the Human Rights Code by way of your human rights obligations, but also by way of your Occupational Health and Safety Act obligations, which are likely also in your violence and harassment policies. Sometimes, if someone's alleging that their workplace or if their mental health condition is caused by harassment in the workplace, that may trigger a WSIB claim, and that will trigger you to file a Form 7. These cases aren't always successful because they can be fairly complicated, but just because they're complicated doesn't change the employer's legal liability to file that Form 7. So I raise that point here as an additional complication. And don't worry, we're going to go through some of these complications in a moment with a bit more focus. If there is a WSIB claim, I just note that if you've also done an investigation by way of your health and safety obligations, the WSIB often asks for those investigation notes, reports, conclusions, because if there's a finding of some kind of harassment in the workplace or some kind of workplace incident that has been a significant contributing factor to the worker's mental health condition, the WSIB will want that to adjudicate. And at least to date, I haven't been successful in arguing that it's none of their business. So yet another turn on that phrase. Before we get into the heavy legal liabilities that I know everyone's just interested to hear, I wanted to throw out there a couple of additional business considerations that can't be lost in this discussion. And you've probably heard this, but even from sitting in my ivory tower, as I refer to it, looking at the legal side of things, time and time again, these business considerations can be quite persuasive. So I thought I'd raise them. Happy and healthy workplaces are good for business. They do help with retention. That's especially important during COVID, when I know that workers sometimes are hard to come by. They assist with positive relations and productivity, which is always good for business. I also wanted to flag that there is something called the National Standard of Psychology for Psychology, Health and Safety in the Workplace. This was something that was put together approximately, I'd say, 10 years ago. It's a voluntary standard that talks about a systemic approach to develop and sustain psychologically healthy and safe workplaces. Some larger workplaces have adopted the criteria or the suggestions in this standard. But if you're looking to improve it just generally, it's a good thing to take a look at. And if you simply Google that title, the National Standard for Psychological Health and Safety in the Workplace, you will see that, can read it. It's quite long, but you may be able to adapt some of those topics in your workplace. So You've heard bits and pieces through the last, I'd say, 10 minutes of my discussion about all of the different legislation that's triggered when we're talking about what do you do with mental health issues in the workplace. I've referenced the Occupational Health and Safety Act, the Human Rights Code, the Workplace Safety and Insurance Act. Every time I talk about the WSIB, that's what we're referring to. Also, general principles of labor law if you're unionized, and employment law if you're not unionized. So what do we do? What does this all mean? And how do you work through this as an employer with an interest in both your employees' mental health and your business? I want to start with the Human Rights Code. And by the way, all of these different mechanisms by way of maybe the unions putting forward or employees can happen simultaneously. And then it's up to your legal team and yourself to sort through them all and decide what you're going to do with them and how. So it can get very messy and very expensive very quickly. From the Human Rights Code, if there's allegations of discrimination and harassment as it relates to that individual's mental health disability or addiction, if there's an issue with accommodation, that might either just happen by way of the process or because of discipline or termination related to a mental health condition or addictions. If it's deemed that the employer has not followed its obligations or has acted contrary to the Human Rights Code, it is absolutely not uncommon to see damages anywhere from the range of $10,000 and up. Some of the most egregious cases get to 6 figures, although that's not common. So that's the range you're looking at for general damages. If somebody has been out of work without pay or terminated, the Human Rights Tribunal routinely awards back wages, and they also have the power to reinstate an individual into their prior employment. And the Human Rights Tribunal and the Human Rights Code can be triggered with or without a union. Sometimes, for example, a union will say, we're not interested in supporting this application. Unlike a grievance, without the union support, a human rights application can absolutely proceed. The Human Rights Code can also come up in civil law claims too. It's not just for the Human Rights Tribunal where the code is triggered. Everyone loves the WSIB. With respect to the WSIB, if a claim is accepted for chronic mental stress or traumatic mental stress, then you're dealing with WSIB's loss of earning payments and how that might affect your cost statements or your premiums going forward. That individual is likely going to be entitled to health care for maybe medication, but likely psychology or counseling treatment. If that person can never return to the workplace, depending on how egregious the situation is or was, they will likely be entitled to retraining, and the costs associated with that will impact your premiums going forward. Maybe that's all fine and well. It's usually not, but maybe it is. Most troubling for employers in our experience is the reemployment obligation. So when a claim has been filed, you might be thinking, okay, well, I'm going to lay that person off because work is dried up, or I'm going to discipline that person for a different reason, or insert your reason why that person may no longer be in your workplace. The WSIB can and they will inquire into whether your reemployment obligation as a construction employer has been breached. That can be just as intensive as a human rights defense. And if it's found that you have in part made a decision on the individual's employment related to the condition that's now compensable, then yes, they'll continue to get loss of earning benefits for a period of time at least. And you can be on the hook for a penalty, which is up to 1 year's worth of wages. That doesn't go to the worker, but it goes to the WSIB. So, and that's again, separate and apart from any of these other liabilities. You're all probably very familiar with labor law, grievances, union implications. Certainly, we've seen grievances for not so much the workplace injury when it comes to mental health or addictions. That's often something that the arbitrator will say is more appropriately dealt with by WSIB, and they won't hear that part of the grievance. They'll bifurcate any issues. But we hear it more with respect to a breach of the Occupational Health and Safety Act. So if there's an occupational health and safety safety policy or procedure that potentially goes above and beyond obligations in the OSHA, most of you have that, which is a very good thing, an arbitrator can award either a decision that says your behavior was outside the scope of the policy, or they can also award damages in addition to whatever the griever is asking for because of that, if it's found that those policies weren't followed, resulting in unfair treatment or a potentially more unsafe situation in the workplace. And again, that can happen separate and apart from some of the other things that I've talked about, with the exception that your labor lawyer will probably need to make an argument that any damages for the injury itself is inappropriate if those injuries occurred by way of the workplace. Employment law has become recently even more difficult with claims of workplace injuries as a result of harassment and resulting mental stress injuries. This is still being litigated, and there's a case that's probably going to be going up to the Court of Appeal, fingers crossed, to help sort out some of the mess it's created. But in short, if there's a workplace injury, typically the employee cannot sue the employer for something like a wrongful dismissal or the injury, I'm sorry, I'll take that back, for the injury in which the claim is based in. There was a case a couple of years ago that said if there's a constructive dismissal as a result of that harassing treatment, those concepts are intrinsically intertwined, and therefore that employee cannot sue the employer for constructive dismissal as it relates to harassment in the workplace and the resulting mental stress injury or mental health issue. In a recent decision, the Superior Court overturned that and said, we actually think that a distinction should be made. And they went on to get into some details about aggravated and punitive damages, which maybe only interest me, I'm not sure. But the point here is that it's suddenly gotten much more complicated to sort through all of this. And if you take one thing away from this slide, it's that absolutely these issues are being adjudicated in multiple forums at the same time. And the last piece that I wanted to leave you with respect to liabilities is, of course, the Occupational Health and Safety Act. Every employer has an obligation to take every precaution reasonable in the circumstances, and a failure to do that can result in the Ministry of Labor's inspectors coming in, asking to see your violence and harassment policies, ordering investigations, and otherwise getting involved with your workplace. And like I said, aspects of that can trickle through to the grievance procedure and result in damages there. We haven't yet seen cases where there's been charges for situations that have led to unsafe conditions as it results to harassment, but it is possible for that to occur. I've talked about overlapping jurisdictions, and I've kind of referenced that I do want you to take that away from this presentation. I want to focus on the fact, and I'll just leave this for food for thought. Some folks at the WSIB are not legally trained, and they can be looking at the case from a very specific lens. And it's not uncommon for an employer to call up the WSIB and say, okay, so you didn't accept the claim for chronic mental stress, mental health issues as a result of harassment. So I'm good to lay off this employee, right? Or I'm good to not accommodate this employee, right? And they might say, sure, or they might say, I'm not sure, or who knows what they'll say. Never forget that the Human Rights Code always trumps. That's the way the legislation is written. Those are Supreme Court decisions. And so while there is a distinction between the Human Rights Code duty to accommodate to the point of undue hardship and offering suitable modified duties by way of your WSIA obligations, always know that the human rights complaint or the grievance can still be brought despite your efforts with the WSIB. So all to say, it is your business. It's your business because you want a happy and healthy, productive workplace. And it's your business because if you don't pay attention to this, you could be, in a situation where you're having to call upon lawyers to run 2 or 3 cases at the same time and sort through how this is all going to work. And I would rather see you as employers do it right the first time, set precedents for the way your employees expect to be treated and the way they treat others in the workplace, use your resources with benefits if you have them, then have to deal with things down the road and have your name on a decision that may or may not be in your favor. I hope we have time for questions. And if so, I'm more than happy to answer them.
We certainly do. And so if you want to stop your share, I'm going to join you on the screen. There we go, perfect. And we do have a time for just a couple questions. And so the first question was, is the duty to inquire a provincial or federal duty?
So definitely a provincial duty. I'm not comfortable speaking about federal aspects because I don't often practice with federal employers. I would be shocked if it also wasn't a federal concept. I also think it's absolutely good business, right? You're not breaching any privacy laws to say, is everything okay? Can I do anything? The duty to accommodate is absolutely Canada-wide.
Absolutely, and we're provincially regulated as an industry, so I like that answer. The next one, and it's been asked in a couple different ways, is there a duty on the employee to disclose? Someone said, can the employer impose a duty on the employee to disclose? And then somebody else linked it to the fit for duty policy. So I'm going to try and get three questions into one. You know, anyways, I think you heard it. I'll let you go.
Yes, and I think the answer is no, there is no duty. And I'll use two examples, one being a mental health condition and the other being specifically addictions. If somebody's coming into work and is displaying behavior that's quite unusual, and the employer says, hey, is everything okay? And that person says, absolutely, absolutely. What, you know, why would you say otherwise? And this persists. You could even get that person to go to their doctor, and that doctor could write a fit for duty note, right? Similarly to addiction is different than substance use, right? Addiction and use is different. So they could come in smelling like they've been using a substance. They could be behaving in a way that's unusual that suggests they might be under the influence of a substance. And you say, hey, are you okay? I'm not going to talk about testing, but you ask the question. They say, yes, I am. There's no duty to disclose, but then there's no duty to accommodate. And then once you've asked that question, once you've inquired, if that leads to discipline because that person has been harassing somebody in that workplace or is, you know, falling asleep on the job because they're under the influence, then that is disciplinary. The caution again that they can come back later and try to correct it by providing medical information. Mental health and addictions are difficult because part of those conditions are relapses. And part of those conditions are difficulty even admitting that there might be a problem to begin with. So there needs to be some patience. But if you ask and they say no and they do not disclose, generally then there is no duty to accommodate.
And then I'm just going to say something and tell me where I go wrong. But essentially what we heard there is if they don't disclose, that reduces or eliminates the duty to accommodate until it does become, I guess, visible or out in the open, which could be through discipline or a last chance agreement or something like that. And in which case, then the duty to accommodate certainly kicks in.
Yes, and I think the last chance agreement is a very good example there. We often see it, right, where there's progressive discipline, maybe leading to a discharge. And then the employee, you know, with the support of the union might say, I got to talk to you about this. I need to tell you something. You know, could we then hold firm and say, too bad you had 10 chances and you didn't come and talk to us about this? We could. But more often than not, we see those situations resolved with the last chance agreement and the opportunity for treatment.
And I guess the takeaway is, in theory, it doesn't matter when somebody asks for help. When they ask for help, it's time to give help, I guess, as employers.
That's right. And there's always limits, right? Like as an employer, we're never going to, you know, find ourselves in a situation where it's creating unsafe situations for other people. Or if, you know, we've seen it with addictions where there continues to be relapse year after year after year after year, there's going to be a limit. But the takeaway is these are entirely different than physical injuries, and patience and questions and working with each other is part of the accommodation process and is required.
And then we have a couple other questions, but we really only have time for one more. There was I think it was about slide 12 or 13, you put 5 legal liabilities up on the screen, right? So occupational health and safety, labor board, WSIB, human rights. How does that work? Not everybody here is a lawyer, but people do labor relations. The idea is you have access to justice once, and that feels like access to justice 5 times, but I don't know if there's some comments there.
Yes, and I know it feels that way, and that's why, you know, one of the things I spend a ton of time doing is trying to straighten out the law with these respects. The truth of the matter is it gets very complicated, and especially dealing with workplace accommodation, human rights, WSIB, some arbitrators aren't comfortable in that area. And so it's not unusual for an arbitrator to say, I'm going to hear this aspect, for the Human Rights Tribunal to say, I'm going to hear that aspect. And it's up to the employer to sort it out because the damages are slightly different and the legislation is slightly different. So the situation may be similar or the same, and you can use all kinds of creative ways to introduce things called issue estoppel. But at the end of the day, we have very clear decisions saying this one's different and can proceed because they're asking for general damages. This one's different and can proceed because it's the Ministry of Labor. Those are just 2 examples. But yes, it's how do you deal with, you know, this big salad full of vegetables, if I can use that analogy, for the same situation.
And thank you very much. I'm going to turn over to Ahid to thank you. Hopefully Carissa can stay and answer some of the questions in the chat as well in the Q&A. So there's a couple extra there. So over to Ahid.
Thank you.
So thank you, Carissa, for taking the time today to speak to us about the importance of why employers need to care about the mental health of their employees, not just like specifically through a legal lens. And then, as you said, it's not, they have the duty to inquire into care, and it's not just a business decision, but also like a legal thing that they need to care about. So thanks again. Next, we have a presentation from Dr. Ash Bender. Dr. Bender is an occupational psychiatrist and assistant professor with the Faculty of Medicine at the University of Toronto. At the Center for Addictions and Mental Health, he's a staff psychiatrist and former medical head of work, stress and health program, which is a multidisciplinary program specializing in the assessment, treatment, and research of occupational disability. Dr. Bender has several publications in the area of workplace mental health and continues to provide education and training education to improve outcomes following psychological inquiry and mental health leave. Dr. Bender continues to provide general psychiatry services at the Toronto South Detention Center and the Scarborough Hospital. Welcome, Dr. Bender.
Thank you. I'm just going to unmute here. Is my audio going? Okay. So I'm just going to share my screen here and get everything up and going. Thumbs up if everything is working there.
Yeah.
Okay, great, guys. So I want to thank you for inviting me here today as well, and taking the time to get together, obviously talk about something that is clearly dear for me as well. Now, my focus, I guess, and picking up on what Ms. Tanzola had presented to you, is really talking about what would be that business plan for mental health. What would be those key components that I'm hoping you can introduce today as well. I mean, on the slide here, you're going to see the stats, and I'm sure you're introduced to it in previous talks as well, about how essential services are and having an approach for mental health is for the construction industry, just considering things like high rates of addiction, suicide, and other issues. And I'm going to walk you through some of these components. It was mentioned before, I think it was Dr. Moody had talked about it as well. When we're talking around mental health, this is a dynamic process. And really, while we're here and what we're striving for is things like well-being, reaching our potential either from our career track, education, as partners, as parents, and contributors to society as well. And investing in mental health certainly can help us to benefit not only as individuals, but to the organization and to our communities around. This is why it's so key and important. I think that's often a more important discussion rather than just focusing on disorders. But, I'm a shrink. We focus on disease, pathology all the time, but I have to remind ourselves that no one has perfect mental health, but it's always something to strive for. So what I really thought was interesting is when we started understanding illness and disease from a burden perspective, it really created a different picture and helped us to wait. So instead of this focus on the most obvious, such as severe and persistent mental illness like schizophrenia, that often people think around mental illness, if we understand how mental health issues affect someone's capacity to work or die prematurely from something like suicide or a co-occurring illness or disease, then we're really putting three classes of mental disorders in the spotlight. Depressive disorders that you see in that blue, kind of going from 12 o'clock to 5 o'clock. Anxiety disorders, which go from 5 o'clock to 7 o'clock. And guess what, folks? 7 o'clock to 9 o'clock is substance use problems, alcohol and drug disorders as well. People are people. This is global data from around the world. And I think no matter where you go, these are really the big three at play and what affect working people. The other thing I think we got a sense of what are all the factors. This isn't just about the individual who may or may not recognize that they're having mental health issues as well. They may be experiencing illness of a severity that they don't actually recognize those issues, or they may have their own personal ideas or attitudes that bring to the way that could be a barrier to seeking help. If you go up to the organizational level, having solid policies, good practices that really ensconce occupational health and safety and follow health and safety law are key. And you'll see across the board, it's all about having the right resources in place and sticking to the legislation as it goes and the best practices as far as law as well. And we just had a number of wonderful announcements by Minister Tanzola. These things do make a difference as well and do trickle down to those individuals. So why construction? You've seen it before. If we look overall, often a number of workers are entering and exiting construction areas part of precarious employment. Part of that is the seasonal nature. Whether they're part of a union or not may depend on whether they have stable employment. Also, there's a lot of labor type tasks which require less skill than other areas. So the working conditions put people in at risk. We know it's tough work out there as well. And we see higher rates across the board of compulsive behaviors that ultimately can destructive and likely contribute to the increased rates of accidental death and suicide. Okay, and so then COVID comes in, and how I really think around COVID and what's happening, we've seen this as a stress test. We've seen, some of this is not all bad in the sense that we've seen some positive societal gains as far as attitudes towards racism and equality and factors come into play, but it really has created tremendous barriers around accessing quality of treatment. Individuals who maybe were living at home within an abusive home environment suddenly were stuck at home as well, or may have found that their valued job was not simply available to them. I kind of think of it as that Jenga piece, and depending on what piece you pull out may or may not cause that structure to collapse as well. Okay, so let's weave this around in just a little case here. So this was a case that I had come into play that And Xavier was a foreman, and not uncommon, he has a new employee at hand, not familiar with a lot of the typical organizational practices, may have been trained, but not necessarily have that experience as well. And unfortunately, Xavier had to be a first responder when the apprentice was crushed on the job and was told he's not returning. And it's really in this slow, insidious change in Xavier's behavior, starts missing himself, starts missing shifts. And the only thing that we're really cognizant of is he's not his usual self. You get these vague descriptions. Clearly he's struggling. The question is there a duty not only to inquire about this, is there an ethical obligation to help Xavier? And is there a business case for helping Xavier in this case as well? And we'll go through what those components are. So the good thing is on past ResCon forums, combating stigma is probably one of those key things. And organizations that address stigma throughout not only are more likely to recognize issues, they're also going to stamp out a lot of those pathological attitudes and practices that happen with organizations as well. And this is where following the letter around accommodation practices, challenging things like rumor mill, particularly amongst managers and senior management as well, that are potential barriers to accessing services, and having approaches around accommodation that are standardized not only for physical injuries, but for psychological injuries, actually have anti-stigma effects as well. They tell people that we recognize this is a problem. We approach this with fairness. These are organizational adjusted approaches. We respect confidentiality, and we're going to do everything we can to help you recover, knowing returning to work is part of recovering from mental illness. What I'm suggesting is a key action item is that a mental health champion actually has a designated seat at Joint Health and Safety Committee meetings. Because when you have that voice and sensitivity at these meetings, they're going to recognize problematic issues that can be addressed more proactively if you're recognizing the mental health component here as well. Often you'll find someone that may have had their personal experiences through this, family experiences, or simply is just something that they're passionate about, which we all are here today. So that's probably one of my important action items here as well. The other is just recognizing there are certain things that will cause psychological injury at work, not all preventable, but a lot of kind of the things that you can have control at work are this idea of around how much strain are we putting on our workers, and is it modifiable? And are we doing things to prevent critical incidents? These could be, for example, serious injuries, deaths of staff, fatalities, or being present with serious injuries occur as well. These are really clear things you would want to inventory. So let's talk about job strain. So let's say you got a super controlling boss. You hate your job. You can't stand your family, and you have no friends. Extreme case, I know, but this is an example of how those factors, even one of those factors, can be contribute to that experience of quote unquote stress or job strain. What's important to know is, as humans, we all react in very similar, predictable ways. Not only does it place us at risk for increased psychological distress, we see it come out in hostility, workplace violence and aggression. We know that adverse job conditions such as noise, heat, poor air quality, poor shift work schedules can lead to increased rates of violence, but not only depression, anxiety, exposure to mental illness, but also on the other side, increased substance use. You'll see higher rates of smoking, and then perhaps substance use on the job or after the job. And being aware of what the job strain factors are at work, and thinking ways to modify that through recognition, support, and being creative that way rather than just thinking remuneration can have significant impacts on job strain. So there are some measures out there that you can look at job strain within the environment as well. Changing minds at work, there are some proactive groups that can look at job strain. The other part is being aware of one of the unfortunate critical incidents that happen is suicide. And, you know, I said before, believe it or not, I was not born a psychiatrist. And one of the reasons that I got into workplace mental health is we grew up having a family concrete business. So, you know, I was operating forklifts, driving trucks around. I think I started driving at 12. Thanks, Dad. But I remember in my first year of residency getting a call from my dad, who's this burly Mennonite guy, crying on the phone. I'm like, Dad, what's going on? And I had worked at the family business summer after summer. We had about 200 employees, knew everyone there. And he's like, you know, Jim's son died at work. And so I'm like, what happened? And we're never going to really know what happened that day. But this young lad was the son of one of the longtime workers, was in a batch mixer, and the next crew had come on, and he was trapped in the mixer as well. The only thing we do know is after the Ministry of Labor investigations, all those factors that young gentleman had got into some legal problems that we didn't know all the details, and that made us suspect it could have been a suicide. I think what was key is the not only the personal loss and the responsibility you feel as an employer, was that it took a year for the manufacturing facility to get back to the usual numbers as before. So that single critical event had a profound impact on the organization as a whole. I think things like suicide and those factors is one of the impetus for the first responder first program. And this was not only dedicated towards reducing suicide in police, fire, and other emergency services, it also gave a proactive and preventative strategy for addressing the impact of critical incident exposure at work for these officers and others. So I encourage you actually to check out the first responder. It's a framework for PTSD, but in reality, what we did in collaboration with the Ministry of Labor is put together a strategy for mental health as well. There's policies there, there's inventories you can do as an organization, and there's also connections with crisis supports as well that I encourage you to have available to your employees. It's tough to reach them in construction, I know. So are these things that are posted at your work site. Third recommendation is, what kind of training, mental health training, are you making to your staff? These are, you'll have site supervisors, foremen, other crew leaders. Have they had specialized support? And one of the key things is people may be trained in first aid for physical injuries. Do you have someone on the crew on site that's trained in psychological first aid? Queens offers a certificate in psychological first aid. I believe there's one that's available through CMHA and other organizations. I encourage you to train someone, have someone designated who can respond to mental health crises, knows how to keep people in supports, and help them bridge that gap between something happening at work and something happening off work that may not be under their control. This is probably another key recommendation that I'll bring to you as part of your business plan. The ultimate bridge is the supervisor, the foreman that knows the crew, works directly with them, and may have access to them in ways that you simply would get in upper management as well. And do they know how to engage in supportive dialogue, encourage workers to seek help, but understand the ethical and likely legal obligation of maintaining confidentiality in these cases as well. It's a really key part. So have you trained your foreman not only in psychological first aid, but do they have some training in how to address workers as well? Peer support. I mean, I still think it's one of the most effective tools. Most people who are in mental health difficulties are reluctant to speak to their superior about that. And hence we have things like the duty to inquire, but will actively share their difficulties with peers, co-workers, colleagues, and maybe even find them using them as a primary support. So actually having some sort of peer support in place can be that area of first contact for individuals, and then that peer support with proper training. And maybe this is part of a peer representative on joint health and safety committee meetings as well, can also set boundaries and know how to guide that peer to the appropriate help, and also encourage them to report any concerns around their mental health, substance use issues to their superior, knowing that they're going to get the help that they need as well. So what happened with Xavier as well? So Xavier was actually was a foreman himself, but also had good relations with his manager, who he saw as a peer as well. Hey, connect with your EAP as well as one thing, but also they were additional reaching out because they thought this is something more than maybe requires just 4 sessions of counseling as well, encouraging them to connect with their medical supports, like their family doctors, in this case for medical clearance, because there was concerns around, was he coming to work fit for work as well, at his best as well, and how is he doing off work, which are really signs of something more severe in this case. So how do people access care? You need to have a pathway. What can you do as employer? Key parts is when you look at your EAP program, are they actually offering counseling or services that benefit people? What you'll find is instead of just funding for short-term focus things, do individuals have access to evidence-based care, which may include 12 or more sessions with a qualified psychologist. In this case, we're seeing shifts in benefit coverage away from, chiropractic care. I think my wife is a teacher. She's got up, she gets thousands of dollars for chiropody and support hosiery, not that she needs any of it, but only recently did they start to beef up psychological benefits to cover $3,000, which is the most common factor, most common issue affecting workers these days. So making sure your benefits package is balanced towards the mental health issues. Things like, is there coverage for residential addictions care and aftercare thereafter? Just getting someone right away into a 30-day program and having those supports after is really setting up an individual for relapse. So if you understand the course of these disorders, and maybe you've consulted with some benefits consultant experts, maybe if you're coming forward with your collective agreement, are we really advocating for the right things when we come to the table with our employer, and should we be asking for more mental health resources if we want to tackle this? And who's our insurance carriers as well? I think a big gap here is when people transition from short-term care to long-term care, there's a missed opportunity for them to get help in that short-term disability. How do we keep that rehab focus and getting them access to care right away? So Xavier was actually taken off work. He'd been away for 3 months, did connect with a psychologist, and the family doctor recommended a gradual return to work. Fortunately, he's been texting with his peer supports at work and his foreman to find out about all the changes. Well, lots of changes always happening here as well. And this is a case where his manager is just not sure how to accommodate someone who's returning from mental health and maybe even feels uncomfortable talking about it as well. And this is where having the key. Bottom line is you can approach mental health accommodation just like you would if someone was away after a physical injury as well. You know, I throw this kind of scenario out. Do you throw a party for someone who's coming back after a mental health event? And I would say, hey, why not? Why don't you ask them if they would like a party or a recognition of coming back? And if that would feel good, tell them you'd like to do that. Give them that option, just like you would for physical injury. So we think we got to check in with some of our own personal attitudes, assuming that people would be embarrassed, wouldn't want that recognition or support just because you think you might be embarrassed and wouldn't want that support. If we stick to the principles, and this is from Institute for Work and Health as well, these easily apply and overlap with mental health difficulties. Not only a strong commitment to physical health and safety, that you're establishing strong commitment to psychological health and safety throughout. This is through tackling stigma, having policies and practices that reflect that as well. Instead of saying, I want you 100% before you come back, or I don't want you at all, offering modified work and providing meaningful modified work for people that may be having residual psychological difficulties, perhaps some have some restrictions based on their status, sends a strong message that we value you and we want you back, even if you can't do the same thing, because we think you're going to get better as well. Often this needs coordination. Supervisors need training and information. Confidentiality could be a barrier, but asking people, hey, what information do you feel comfortable being shared with your manager? Sometimes an employee will opt to share more information than they would want, which can really facilitate a return to work. I know from my colleagues, you know, we really try to welcome people open arms. I have a number of colleagues who've come back after depressive disorders as well. And I appreciated them sharing it with me. And it really helped me to accommodate them more as a clinic head in this case at CAMH as well. And the other is keeping the line of communication between your occupational health team and their medical care providers. This is a dynamic situation, and it's you know, Ms. Tanzola talked, is these can be chronic and relapsing conditions. So recognizing that, and just rather than expecting someone's just going to make that graded return to full recovery, is key principle coming back. So the last recommendation I have is this is a process. And along the way, you're going to not only collect data, which is a key part that you'll have available that goes beyond absenteeism, missed time, but you're also going to look at utilization of resources you have, WSIB data, but then also these indirect factors, which I think, quite frankly, speak to your competitiveness, not only your ability to attract employees, but retain them. And capturing and paying attention to indirect data, I think really strengthen the case for having strong mental health policies and practices within your organization, and ultimately leads to recognizing problems earlier before it results in serious injury, death, or suicide in these cases as well. Data with a beard, I put them up there for me. Bottom line, I mean, really what we're asking you is to take a calculated risk. And the business case here is easy to see because we know the long-term risks for neglecting these issues really just far exceed this at this time. couple of resources for you that I can happily make that available to the group as well. And I'll just bring attention here that Workplace Safety North just put out a number of videos, I think, that you could easily incorporate into your resource list. And then as employers, or let's say you're a designated mental health champion, these are just great websites on top of the First Responder First that you can access as well. Thank you. I'm going to stop sharing. Any questions out there? I think we might have a little bit of time. I tried to stay within the rules there.
Yeah, maybe I don't see any questions yet, but I guess as COVID hopefully wanes and we're becoming vaccinated, people are re-emerging into society. Are there any like emerging trends that you've seen since COVID has like started to wane and we've kind of been more reacquainted to like other people, et cetera, et cetera?
Yeah, I think that you bring up a key point. I mean, they looked at some of the surveys that I was aware of for. Still, the number one issue is the actual safety of the workplace. It's still number one, even for individuals that have mental health difficulties, may require accommodation in some case. Across the board, safety at work is still the number one issue. And I think within the construction industry, not only you have the physical safety issues that we're often dealing with, now it's the exposure, these contact exposures. So it's still going to be number one on the list. So having good, effective infection control policies and practices is probably one of the most important things you can do, even for people that have mental health issues, because neglecting that will exacerbate things like anxiety, mood symptoms that people may have been experiencing already broadly across the board. So really having that is number one.
And then I mean, you talked about stigma, reducing the stigma. And I mean, I didn't know this before, but you do come from a kind of construction trades background. And kind of going into this mental health first aid. What advice can you give people here, especially since like the culture of construction is still very strong? It's a very like unique workforce. When kind of breaking down the stigma, so like how do you tailor? I would assume that your outreach and awareness raising needs to be tailored to your audience. And then second part of this question is, you spoke about like some of the mental health first aid training that's available. Mm-hmm. Do you think that training also should be tailored to the construction industry, or most of the training available is kind of applicable industry-wide?
Yeah, so I mean, the issue around stigma, I think one of the most powerful tools for tackling stigma is having this mental health being taken on by someone in senior leadership and someone sharing their story and opening the dialogue. Because time and time again, people are shocked when they share their story just how supportive they are. And this helps people to overcome this idea of self-stigma as well, which can be just as strong or stronger than the actual stigma that they receive from others. And this is part of not only the mental health champion that sits at the table with the occupational health, this is also a mental health champion within senior leadership. I mean, folks, we all know either personally or someone we love experience mental health difficulties. It's not hard to find these kind of stories as well. I have people within my family, extended family, friends, you name it, addictions, other mental health issues. So I think that's a powerful tool as well. The other part is I don't think everything has to be specifically tailored to construction, because people are people, in so many aspects. And the more we kind of, the psychological first aid, that's something that would have apply broadly to people. How do you attend to someone at need, coming to work with emotional difficulties, perhaps impaired, or knowing or going through a personal crisis because of something out of their control at home as well? These are just skills. Instead of saying, at work, it's like, where's the psychiatrist? Whenever something goes wrong, they get to ask, where's the psychiatrist? But really, they're just asking for someone who feels comfortable talking to someone else about their problems at work, as a professional to a professional.
Well, I think we're at time, but I really did enjoy your presentation, and that you were able to kind of bring up your personal perspective and experience within the construction.
It was impactful, and quite frankly, it motivates me.
Mm-hmm. And then just one of the last things that you said was having that support from your superiors and your colleagues, and that kind of bridges well into our final presentation or conversation of the day, which is with Cal Bear and Rob Tremulak. Rob will share his lived experience with addiction and recovery, but first I'm going to introduce Cal. So Cal Bear is the Vice President of Workforce Risk and Worker Wellbeing at CSDZ, a Holmes Murphy company, which is based in the States. Since 2010, Cal has served with the National Action Alliance for Suicide Prevention and is on its executive committee since 2016. He serves on the expert advisory group for the Center for Workplace Mental Health and for Heritage Cares. Cal was instrumental in the launch of the Construction Industry Alliance for Suicide Prevention. Engineering News Record named him a top 25 newsmaker for 2016 in the global construction industry for his work on suicide prevention. Cal has been a great help to the ResCon team 2 years in a row with helping coordinate and plan our mental health events and get us excellent speakers like Rob. So Cal, I'll kick it over to you.
Thank you very much, Amina. I want to thank you and Andrew and Ahed for the great work that you've done. Your leadership in this area is exceptional. You've become internationally renowned for your symposium, and we thank you, all of us in construction. Your partnerships speak for themselves. The caliber of your planning, the work that you do behind the scenes to make these events so impactful, I think is really impressive. So thank you for your leadership on mental health, for stigma reduction, and really for bridging over now into addictions. It's really, the time is now to address these topics. It's important that we remove judgment on addiction. And the reality is, for many construction workers, our first dose to opioids comes from a workplace injury, a prescription, following medical advice. The same for our families. It could be dental, it could be a surgical procedure. There are non-opioid medications available. There are surgical and dental protocols that are called opioid sparing. It's a powerful movement that we're seeing, first dose prevention. The time for those with an addiction to avoid surgery because their fear of becoming re-addicted is a real issue. So we have labor unions, the International Foundation for Employee Benefit Plans has large Canadian presence. There are other groups that are partnering in this cause. But today, what Dr. Bender said about the power of lived experience, it is my pleasure to introduce you to a Canadian iron worker who is very brave and courageous, a person with integrity and transparency, someone whose story is real and raw, but it shows a pathway that help is available for those that seek. We have no time like today to address the issue of addiction. Rob Tremulak is a new friend, someone I'm pleased to be introduced you to ResCon. Rob, you're gonna tell your story over many years of addiction. I'd like to introduce you as a proud iron worker, of Local 700. You're from Ontario. You're a huge Maple Leaf fan. We share hockey is one of our common passions. I can't thank you enough for you agreeing to share your story with these great folks at ResCon and the audience today. Thank you for taking time, and thank you for your courage. Mostly thanks for your care for your fellow tradesperson to show people that hope, help, and recovery go hand in hand. So Rob, thank you. I want to thank you for all the effort that you've put into this.
Hi, everyone. Can you hear me?
Yes.
Okay. Thanks for the kind words, Cal. It's my privilege to met my new friends from ResCon. It's been fun and interesting and informative and educating, just the few conversations that we've had preparing for this. So it's my privilege to be here to share my story in the name of with the intention of helping my peers and helping others. So thanks. So I'd like to start right here with defining addiction as it was first defined to me when I first started to make changes in my life. This was really important for me to understand this in order to move forward. So the place I went for treatment, the De Novo Treatment Center, introduced me to some of Gabor Mate's teachings. And what Gabor Mate says, and I used this in the very early days of my recovery, and I still use this today on a day-to-day basis, helping myself and helping others. But that Dr. Gabor Mate, Canadian addiction expert, defines addiction as any behavior that gives a person temporary relief and pleasure, but also has negative consequences, and to which the individual will return time and again. So in saying that, I would just like to elaborate a bit further. And I'd just like to change the question that often many family members, employers, supervisors, people who maybe don't suffer from addiction, but do see others that do. And the question goes from, why does the addicted person continue to use in spite of such obvious and negative consequences? And if we just change that question, and I did this early in my recovery, and I still do it today to help myself and others, just change it to, what does using do for the addicted person? So in saying that, I just also like to elaborate on some things I've learned, like the characteristics of addiction. And I had to learn this stuff in order to get clean and sober, and to stay clean and sober is probably even more important. So I had to learn that the characteristics of addiction, like addiction's extremely efficient at disguising itself. So for the addicted person, denial, blaming others, it's very blinding and manipulating. And the addicted person seems to be able to justify, rationalize, and minimize their actions and behaviors on a day-to-day basis over a long period of time. And that's pretty much the story of my 25 years of using, how I allowed myself to get away with being an everyday user through my early teens, into my 20s, my 30s, right up until just after my 40th birthday, when I finally found recovery. So I just like to share a little bit maybe on my experience with that. Like in my experience, recovery is true connections. It's kind of like another word for connections to me is spirituality. So true connections are positive, they're good, they touch me at my core. And on the addiction side, and this is the disguising side of it, and I know this now thanks to recovery, right? Like I didn't know this at the time, obviously, or I might have been able to solve the puzzle of addiction sooner in life. However, during my addicted and using years, and even prior to, there's also what appears to be positive connections or spirituality. However, they also are temporary, and they're kind of like falsehoods. So, connecting with others that used in my early years, that felt like a connection, right? Here's other people like me, we were making a connection. However, those connections seem to be temporary and often had some negative consequences, taking me away from my true connections, which might have been healthier living habits, healthier lifestyle, staying on task, being more open and honest, things of that nature. So with that, I think I'll move on to my youth and just kind of start my story through addiction and into recovery. It's important for me to lay a little bit of groundwork about growing up in my family. I grew up in a family, as far as I knew, was a very normal, loving, caring, positive family. Recovery has taught me, though, in saying that, and I don't blame my family for any of my addiction issues growing up, not even slightly. However, there was kind of the breeding ground for addictions to kind of start happening. Just I was unaware of them because I was a young boy, and that's just the way it went. But so like growing up, I loved to play sports. I did it. I found hockey, I found baseball, I found running, I found track and field, I found friends that did that. And I did that through, the first 12, 15 years of my life on a day-to-day basis, every day. Like we'd play at recess, we were playing with the tennis ball, ball hockey. We'd get home from school, we'd hit the tennis courts, we were playing hockey. During a baseball season, we had the strikeout box on the back of the school, we were playing like strikeout. Like when I was by myself, I'd make up little games, with the tennis ball off my front porch steps where I'm throwing the ball and, and I'm playing a baseball game. So I found a lot of, comfort and a zest for life in doing and living that way, for a long time. So, but as I got older and as time went on, I started to notice, like that's what I did during the day. And, late, just pre-teens and early teens, I started to, when the sun went down, I still liked the rush or the adrenaline that I got from playing sports, or the good feeling, the connection. And I found some friends where we'd kind of go and cause havoc in the neighborhood, it's little things, maybe throwing snowballs at cars for the chase, maybe playing Nicky Nine Doors, but I was the guy that knocked on 4 or 5 doors in a row, not one, and ran away. Like I had this, this what I thought was, no fear of getting caught type thing. So, and that was kind of the story of my youth. So what I've learned thanks to recovery is my family, as much as it was a loving, caring atmosphere and meant well, there was still a lot of things that were happening. And as they were happening, one of the things were there wasn't a lot of communication in my family. So I didn't really have a place to develop just talking amongst family members on a day-to-day basis about what was going on. And in not being able to do that, I didn't even really learn how to identify how I was feeling. So one of the survival patterns that I learned was like normalizing everything. Things that were going on in my house, I kind of just shelved them. I didn't deal with them. Although I called that dealing with them by normalizing them, right? So what that did was
the presentation.
That's okay, I can carry on. So what that did was help me like look past what was really going on in my family. So there were some things that were going on, in my family that weren't good for a kid to see. There was some criminal activity, there was physical and a mental, emotional abuse between my parents. There was secrecy, there was, broken homes, there was parties and addictions. And, and I remember, even when relatives kind of passed on, my parents were trying to protect me, it seemed like all the time. Like I didn't get to go to funerals. I was kind of shielded in a way. So that developed some belief systems and survival patterns. So kind of moving on, into adulthood, or just before I move on, like I kind of started to notice what started to happen was kind of the tale of two stories, right? So there was the good connections, the spiritual connections, what I was supposed to be doing in life, which was really, really, really great. But very close second was, the disguise of addiction, we'll call it, causing trouble, misbehaving, and some of those characteristics of addiction, isolation, justifying, rationalizing, minimizing my actions were starting to happen, before my first drink or my first drug. And so carrying on into my later grades, like 7th, 8th grade and into high school, these pros and cons of life are these true connections and temporary connections, if you want to, started just carried on, and I started using. So back to the question, what does using do for the addicted person? When I find when I used, and again, without me even knowing it, because of the disease of addiction being kind of blinding, and there's the denial factor. But what it did was maybe those things that those coping mechanisms, or those things that were never dealt with even before I took that first drink or smoked that first joint, they were lifted. They might have been bugging me. I didn't know what it was, but what I felt was peace and joy, even if it was for a short time, just like happiness, pleasure, nothing else bothered me. There was no negative. So I continued using, and I continued growing and learning, and I thought all was well. And I eventually, my parents broke up, and there was a kind of an ugly divorce, and it came time, I was in 10th grade, and it came time to move in with mom. Some other things happened that I didn't know about, that were kept secrets that I did find out about, and I just normalized them, that survival pattern that I learned at a young age. So in normalizing the life that was happening, what I did was I just carried on that way, and I went and moved in with my grandparents. So moving in with my grandparents, soon the negative consequences of using were kind of happening. The not dealing with things, or having the tools or the coping mechanisms to express and identify how I was feeling. Unhealthy relationships were beginning to happen. And I stopped going to school on a regular basis. My attendance was down. And my grandfather, who's an iron worker himself, who I have a great relationship with today and is still alive, which is amazing. He sat me down and said, and he nicknamed me Rock. Rock, if you're not going to go to school, you're going to go to work, right? And hence the conversation of the apprenticeship of the ironworkers, had started. So just as kind of the negative consequences could have started to show themselves, a positive happened again. There's my grandfather. He wants me to do well in life. He gives me a solution. Let's go to work. And I started apprenticing. So, there's kind of the disguise of addiction, and the two tails of the tape, or the two sides of the coin happening again, where as I share this stuff, I hope other people can see the signs that I missed. So that was the sign, I'm dropping out of high school, and I'm opting to go to work. So carrying on with that, I started my apprenticeship, and in doing that, in the construction industry, is like a whole new pool of high school kids, but now they all have money. So the drugs became even easier to find. They became even harder. They became more often. And with that, it's appeared to be more connections being made, but they were temporary and likely with negative consequences. However, I'm doing this good thing. I'm moving forward. And bang, I meet my wife, who's still with me today. It's a beautiful connection, right? That's the true connection. So, and then my wife, she's still with me today. She's here today. Next comes the house. Next comes, in that chaos side of this other side of the world, I had a son who I hadn't seen yet, who I decided wasn't my problem, but my wife and her, and her good nature, we started seeing my son, and then we had our first daughter. So, and then we bought our first home. So here we go. Now, life is rolling from the outside. it looks like my mom used to say, you got the $1 million family. You got the son, you got the daughter, you got the job, you got the home, everything appears to be going well, but little does everyone know I'm using every day, all day, some type of substance. So, and that kind of just, that theme kind of went on through my 20s and through my 30s, in a way where the consequences kept getting bigger, but so did the rewards, like I started running jobs, so and that's another thing that addiction did for me was it's really good at magnifying the 2 or 3 or 4 things you're really good at and hiding the 25 things that you're screwing up. So that's kind of what it did for me through my 20s and into my mid 30s. And the consequences did start getting more like closing in and narrowing my ability not to see or take responsibility for my actions. And it really probably started to fall apart around 35 years old. By now my wife's left me a couple of times due to my behaviors. She's found some substances and I've always lied my way out of it. Told her I would stop, and I'd always cut back for a while, and things would appear to get better, but would always circle back to the same old. And I do remember struggling with why can't I get this right? I have a beautiful family, a wife who loves me, a great job, and yet every couple of weeks, I'm blowing the bank account up and I'm getting caught in lies, and I'm just not living an honest life on a day-to-day basis. So moving on, just before I found recovery, I found my last drug of choice, and that was, the Christmas break of 2014. So just before 2015, just before my 40th birthday, I try, and I might as well, I don't mind being drug specific, but it blows me away that I even got this far into my life. But I tried crystal meth at 39 years old. Like, who does that? But I did. So crystal meth, it brought on a whole new level of negative consequences that in a very short period of time, just 8 months. So something I hid from myself for 25, 26, 27 years that couldn't really be exposed, was exposed by this drug of choice, which was crystal meth. And by this time, I found myself, by June of 2015, I lost my supervisor job with Black & McDonald, and that was all I had left by then, was using every day and that job. I was a supervisor. I had a lot of responsibilities for a few years, and they had to walk me off the job. And by now I was so deep in it, I knew I had a problem. However, I didn't know what I was going to do about it or how I was going to do about it. And I preferred to just keep using and keep myself in a place of almost oblivion until, the powers that be came together, and I ended up finding myself just as at a point where I was financially, I was physically, emotionally, mentally, spiritually, and financially broken. I was like bankrupt. I had nothing left. And my hope is people can recognize their problems or their stories or their addiction or the signs, that the red flags that go up for them sooner than they get to that point. But that's my story. And I ended up in the road to recovery, we'll say, was moving on to de novo. That seemed like the last place I wanted to be on earth. And I can tell you today, it's the best place I've ever been on earth. So it's kind of come full circle, and a process had to happen for that to be true. I'm just going to check the time to try and, okay. So I began treatment, and de novo means a new beginning. Okay. So what had to happen for me to recover was, my union got involved. They were involved the last few months and played an integral part of getting me into that treatment center. My family, my wife, who had locked the doors and had, a police, a restriction against me. I wasn't allowed to see my youngest daughter. Like, all kinds of things had to happen, like a hitting bottom of sort. However, when I got to de novo and I stopped using, which was the first thing I had to do, which would never occurred to me in the 27 years of using, like, just stop using for a period of time, see what happens, Rob. It's almost mind-boggling. But I returned to the spirituality. What happened was making true connections happened. And Also, what had to be there was a safe place. This De Novo Treatment Center the energy in there is pure compassion. There's zero judgment. There's everyone there pulling together to help save lives. People were there to want to save the 21 guys that were there, and myself. Everyone from the guys that have only been there a week or two were on program, to the counselors and to the other staff members. So then what had to happen, and it took a little bit, was sharing. I just started sharing honestly. I never did it my entire life. Going back to my coping mechanisms that I never learned. So I started to get some tools of recovery started to be shown to me at the De Novo Treatment Center. So I began to learn that healing was an inside job. So if I'll move on to the keys of recovery and why De Novo works so well in the construction setting and for the tradespeople in Ontario, in my view, it was a lot like the apprentice journeyman structure that we have in the trades. I remember walking in to that treatment center, on day one, and people on week 3 and 4 were like the journeymen coming in to welcome me and to share, how far they've come in just a few weeks. It felt like they've been there for years. They've learned so much, like a 4-year apprenticeship, say. The counselors and the staff were like the supervisors and the foremen, and the people running the job, and everyone was there to, it was like the school of life was what happened, and I think I missed out on the school of life growing up. And then I was introduced to 12 spiritual principles that are attached to the 12 steps, and that began the process of recovery. Right away they started putting in structure and healthy habits. Started eating healthy, started reading literature that was positive and healthy. They even started, you could play volleyball and hockey and baseball and go for a run there. And they had someone from, a gym there. We really started to learn how to live without substances for the first time for many of us that were there. So, and then something else caught my attention, and that was meditation, and a lot of us in addiction have this thing we say we can't stop our brains from thinking, from going and going and going and going. Meditation is a tool I use today, not to stop what's happening in there, but just to have an awareness and watch, and a place of observing, and I just want to relate this a little bit to construction before we run out of time, if we haven't yet. But I mean, in construction, and I am a supervisor in construction. I guess we'll go to present day, and I'll try and wrap it up in,
There's still a decent amount of people on the call now, which is a good indication.
Okay, I'll just carry on then.
Yeah, no, you're good. I think we have a couple more minutes. We can go over a bit.
Okay. So, yeah, there's a stigma in construction, and I heard a lot of great things here today. And I think the unions, as far as in my experience, are doing a really, really good job at breaking the stigma and opening their arms and their doors and creating this safe place that I'm talking about, that you don't have to fear losing your job if you admit that you have a problem with addiction. That was never really there before. So there's good things happening. On the employer level, it's there. It's in their litigations, I guess. But at the same time, you sign that if you come in unfit for duty, it's grounds for termination. So there is maybe not such a warm, welcoming kind of setting for me, if I had a problem today, to walk into my employer and say, hey, listen, I got a problem. What can you do for me? However, I do have that at my union level. And I think the employers are trying to move forward and making good gains. So a lot of the things that the younger workforce coming in have to deal with, I believe, is the same things that I had to deal with. And that was these temporary connections you make partying with others who might be coming straight out of high school, and they appear to be your friends, and they mean to be your friends. However, these, it's a slippery slope. That's something I heard Andrew say the other night. It's a real slippery slope. I remember taking my first Percocet because I came in hungover that an old timer gave me. That was a slippery slope. I'm not blaming anyone, but I mean, if I was living in my truth and had my spiritual connections in line, I would have said probably no to that. If I, put it this way, if I had the chance to say no today and go back to that moment in time, I'd definitely say no, because it's a very slippery slope. And if you're using substances every day, and a really good sign is, a question to ask is, what's the value of your relationships? If you're struggling with your partners, your parents, your coworkers, and you're always blaming everyone and not really looking at yourself, that's a good sign that maybe, using a substance every day is hindering, your your lifestyle, your life, your quality of life. So I'll move into present day, what I'm doing, and and how I do it. And so basically, I learned another good tool I learned was to live one day at a time. Right? It's in my email. I've learned, like I said, meditation. I've learned how to slow life around me down. Just by living without substances and living, and I don't really, I think it's important to mention that I don't really define my years sober or living clean as being a measure of success. How I measure that today is how healthy my relationships are, how healthy of a productive member in all my communities am I. And today I can say, like, I've rebuilt, renewed, and restored connections on a level that is mind-blowing, beyond belief, beyond anything I could ever imagine today. I walk in, to supervisors' offices, I can speak freely. I have my wife, I can speak freely. I can speak freely to my children. I go out in the community and I share my story freely. And I do this because I know when I'm living honestly and in truth, nothing can really hurt me. I can't hurt myself for sure anymore. So yeah, today I really have a really, really great work life. I'm working at the Gordie Howe International Crossing. I just finished a 42 and a 43 day in a row stunt. And that kind of, just thinking about that's kind of how working in construction can also fuel addiction. Like, here I am in recovery. If I don't take care of myself mentally, and I'm working because of the demands of the job, I'm fortunate today that I have these tools. But when I worked like that back in the day, it tired me out. So it felt like a reward, or it felt like relaxing to go out for the beers after work and to pop a pill the next day to get through the day. Like, it's very demanding, and that's another area that we have to work on in construction. I just found myself caught up in it early in my recovery. I wouldn't work a job like I'm working today. I would work a 40-hour-a-week job because I didn't want to fall back. I knew I had to learn some of these. I had to hone some of these new skills I learned through the 12 steps and the 12 principles. And I'll just end with, I really just became a student of life again. That's what I did. I've read probably 2 stacks of books this high. Before recovery, I didn't read one book from cover to cover. I do it like it's my job because my life depends on it, and I want to help myself, and I want to be completely and totally happy, joyous, and free with serenity and peace of mind. And I want to share that with others. Like, I want to show people you have all of this inside of you. You just have to find your way to get there. So I think I'll end with that. And I hope I covered some ground today and showed some awareness and shed some light on the subject. Thanks for having me, everyone.
Thanks, Rob. I think your story is truly inspirational, and just much needed. I think we hear about, there is an issue in the construction industry with mental health and addiction, but sometimes we don't actually get to speak to the people who have gone through the recovery stages or are currently in recovery. So I think that also too, and this is something that we've talked about in previous conversations, is that from like a health and safety perspective, we often talk about, or I guess, physical health and safety on site. It's like, what can we do to prevent injuries? And how do we keep our workers safe? So prevention, but we haven't really gotten to that stage as it relates to mental health and addictions. How do we prevent our workers from like having to go through some of the same situations and experiences you've had to go through? And I think what you're doing now, talking to other people, but I think what you've mentioned before was that you're trying to connect with your colleagues, checking in with them. And I think that's part of the prevention process. I guess just to close, if there's one thing that we've learned from COVID, it's that our industry's ability to grow is and kind of prosper is dependent on the health and safety of our workforce. But again, health and safety must also include mental health. I'm hoping that after today's event, if you haven't, as an organization, began to address mental health and addictions, you will going forward. On that note, I would like to thank all the speakers, including Minister Tobolo, Dr. Joel Moody, Carissa Tanzola, Dr. Ash Bender, Cal, and Rob, and thank you for participating in our webinar. Just as a heads up, we will be sharing the recording of today's event with any and everyone who did RSVP. So just check out your inboxes over the next few days. Thanks, everyone.
Great.
Thank you, Rob.
Thanks, Rob. That was amazing. That was really nice to have that perspective.
And usually what we do is we do a donation in lieu of getting little gifts for speakers. And so, Rob, we want to essentially ask you what charity you want to support, and that's what we'll make a donation to. So, and you don't have to answer right now. I probably could guess which one it is, but it's up to you to choose. So.
I think I did choose with Amina. I sent her an email.
Yeah.
Fantastic.
Thanks for having me. Thanks for the opportunity to share. I know how much it helps others because I've heard others share just like I did today, and that inspired me. So thank you all for having the fortitude to put this on. And it's really nice to have some new friends. Thank you.
Thank you. Okay, I'm just going to end the webinar now. I think